If you would, call the roll, please.
Mr. Long?
Here.
Mr. Matheson? Ms. Reese? Here. Mr. Payne?
Here.
Mr. Carlton?
Here.
Mr. Gentry?
We're going to stand for a moment of silence, and then I'm going to ask our student board member, Braden Gentry, to lead us in the pledge. Mr. Gentry.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, one of the first things we have on our agenda is Youth Basketball League. Mr. Jerry Gentry.
Good evening. Back with a little different request tonight. You know, normally I would be here to say we're asking permission to be able to use the schools for youth league basketball. Well, this year, you know, we would like to play youth league basketball. We're not 100% sure that we're going to be able to with the COVID and everything. And, you know, we know there are a lot of hurdles that we've got to get through to be able to play. So I guess I'm here to ask for your permission, if we're able to play, to use the schools again. And we missed last year, and we know a lot of kids missed out on that. And if there any way possible, we would like to, but we think they're a plan, but with this COVID situation, that could change very quickly. So,
What would your plan be?
to do as many as possible and maybe cut practices to one time a week instead of two, and maybe just play games on Saturdays because of your all's fogging system during the week, and, you know, make some adjustments like that. If COVID, the numbers keeps reducing, we haven't even had the first meeting yet because this is the first step.
Well, I mean, I don't have a problem with their, you know, which I know they will, work on the problems. And I know maybe the principals have some questions, but if they can work it out, we can make sure that it's fogged when everybody leaves, because that's where all the kids gather, you know.
Right.
So.
And that's why, you know, we would have to get out of the gyms a lot earlier during the week than what we normally would. And then if we just done games on Saturday, you know, they would be over earlier than toward it wouldn't interfere with the fogging schedule.
Does any of the principals have any concern?
I guess one concern would be now when we quarantine a class, it's contained to one school. But if we have several schools together, and we have students from different schools playing in one gym, it can knock out not just third grade at Doe or fourth grade at Doe, it can affect 4 schools. And I guess that would be one concern I would have.
How would doing this differ from football games that we have? I mean, I guess a lot of those students are at football games.
Normally football games, you play out of county instead of in county.
Yeah,
Well,
you
no,
got
you
your
got
own
students
team.
in-
You got your youth league up here at the high school.
Yeah, but they have a lot of their games away, like in Carter County or,
But I guess to answer his question,
Well, that
they're
would be
they're
the
all
same.
together. They're all together there too.
right. And, you know, that's one of the issues. Because, you know, obviously if you got 2 teams playing, they would, and one got it.
I don't see any
Well,
different football.
Tell you what, hang loose here, Jerry. We have 2 people that want to talk about it, and then what I'm going to propose to the board is that we move agenda item 8 up to this discussion. So we can have a full discussion, get a lot of facts. And I know on item 8 is the mask requirement for staff. I also know that Mr. Payne has a slide presentation that he's done some review of statistics. So is there any objection on the board to me moving 8 up?
No.
All right, so let's do that. So we've got 2 requests from our to our board to present. And normally what we do on this is give 5 minutes. Chad, you want to present first? Chad Griever.
Ladies and gentlemen, thank you for having me this evening. These children, parents, and staff are now in the midst of the 3rd year of normal instruction being hampered. At last month's board meeting, yet another mask mandate was passed, forcing employees to wear a mask if they were less than 6 feet away from an individual, a distance that researchers at MIT, and I have that study in my hand, found pointless, stating one is no safer from airborne pathogens at 60 feet than they are at 6 feet. Masks, some sort of magical protection capable of stopping particles of a virus tinier than what they're rated to, which is 0.3 microns. An N95 mask gains its name by the fact that it will stop a 0.3 micron particle 95% of the time. A blue surgical mask will stop a 0.3 micron roughly 60 to 80% of the time. I don't have any data on cute puppy dog or longhorn masks. Furthermore, a recent peer-reviewed study submitted to a highly respected medical research journal evaluated the actual effectiveness of masks. Simply put, they found there was no association between reduced spread of the virus and the mandated wearing of a mask. None. That study was sent to the International Research Journal of Public Health, and it was released about a month and a half ago. It was called Mask Mandate and Use Efficacy for COVID-19 Containment in the United States. The researchers did find that the supposed benefits of forced masking paled in comparison to the potential harm. In their own words, by obscuring nonverbal communication, masks interfere with learning in children and can distort verbal speech. They also found that prolonged mask use of greater than 4 hours per day encourages dehydration, which in turn can enhance barrier breakdown and bacterial infection risk, along with increased headaches, sweating, and promote decreased cognitive precision. In layman's terms, masks can damage a child's ability to learn through multiple means and actively put the wearer at risk of being more prone to infection, along with impairing their ability to perform. Another issue is the quarantine system currently in place. Perfectly healthy children not allowed in school because they may have exhibited one of the mile-long list of COVID symptoms, sent home for no logical reason. Some quarantined multiple times. Apparently allergies, bronchitis, strep, and the flu no longer exist. There is only COVID. Is COVID real? Most definitely. Is it deadly? Potentially. It also has a statewide survival rate as of today of 99.987%. To put that in perspective, if you put 30,000 people in front of us, 4 would die from COVID. Any loss of lives is tragic, but the extremes that people are going and they are having to deal with in regards to this is unacceptable. It's been said that following certain guidelines is a requirement for funding from the state. That's concerning the way it can be taken. It almost makes it sound like the children of this county and the staff that guide and teach them are considered collateral put up for a line of credit. Parents, staff, and everyday citizens deserve better. The job of this board is to provide the children of this county a proper education and the staff a stable, non-mentally stressful environment working. Teachers have a hard enough job as it is without having to worry about, do they have a mask on, which I have data that says they do not help. Do they have it on? Will they get in trouble if they don't have it on? We had the situation with kids last year, having to wear masks at the virtual school. It's hard enough to be a kid and learn. It's definitely hard enough to be a parent and try and teach. And it's hard enough to be a teacher to try and educate these kids with all the hoops they have to jump through. The board has done the best they can in some things and others they have not. One of you has fought to do everything they can. One of you has borderline said that they want to treat employees and have them herded like cattle and punished if they don't comply. We, the people, would like to remind this board that personal freedom is not the forgotten relic it's being treated as. Help us all put an end to this nonsense. Let these children get back to having a normal education. Let these teachers get back to doing their jobs. Thank you for your time and have a good evening.
Appreciate that,
Thank
Chad.
you.
All right. Next is John Kutcher.
Thank you, Board. I'm probably not going to sound as eloquent as Mr. Grieger here, because until I was driving here, I had no idea that I was going to even speak before you. And I'm speaking just as a parent, as someone who, like most lay people, just are observing, taking in information, going back, tracking down information, looking at studies, and forming together an opinion, and not even so much an opinion, based on facts and data what works. As for my family, my kids, we're tired of holding our breath every time you guys hold a meeting. And that being said, I do want to thank you for, at the last meeting, to continue to allow our kids to go to school with masks being optional. That being said, I think masks should be optional for everyone, for the kids, for the employees. You know, we make decisions on them as far as their health. We're responsible, but you guys and the staff are all adults and responsible for their own health. And if they feel they should wear a mask, then I believe they would wear a mask, and they do wear masks. It's the same way when you go out to any restaurant or any store in this county and every other county. People who are concerned wear one, and the people who are not do not. So my biggest issue is I now have a healthy middle schooler who is being quarantined for the second time because someone else was sick. As the second time of quarantine came around, was told the first kid didn't have to quarantine because he just came back. He was the one who had sparked the quarantine the first time and was said, well, he don't have to quarantine, he's got the antibodies. And I said, well, are we able to submit to, and can I get you a antibodies test and submit a valid antibodies test? And I had heard, I hadn't found out personally, but that was not okay. Or that, well, they only recognize the antibodies from the first positive student for 2 months. And I said, well, I'd be happy to get a test every 2 months, because the COVID test itself only has a 65 to 70% accuracy rating, where the antibodies test is 95% or better, whether or not my child has the antibodies. And if they do have the antibodies, then can we stop with constantly having to be quarantined and proceed with normal life? Simple fact, compared to last year, my two boys, their attitude and their demeanor, maskless, night and day difference from last year. Whatever it, whether it's the oxygen, being able to communicate, I personally tell a lot about a person's attitude just by how their mouth is. When someone's angry, they tend to tighten up their mouth. And it's really gone a long way in just that effect. But my biggest concern really is that there's kids out there that are facing abuse of all different kinds, physical, sexual, emotional abuse at home, that when you quarantine them, they now have to spend that time with their abuser, which is far more dangerous and deadly. I know by looking at studies from the CDC that just in the first 2 months of this year alone, over 1,500 reported cases to the ERs for attempted suicides, as opposed to the total of under 500 of actual COVID deaths from the beginning of the pandemic until now. For me, that's unacceptable. We stand up and we pledge allegiance to this flag. Thank God, in this county, in this place, we still pledge allegiance to a flag. But that flag is for the people. It's not the people in the office up there in Washington. And we owe that to them, to everybody here, to do what's right. there are far more things deadlier than COVID out there. You guys know that. I'm sure you've all heard, seen studies, hear things. I don't need to tell you much more. But even just for some kids, especially the kids that educationally are lacking behind, because they need that in-person contact. They need that someone to give them that extra bit of attention. But just the simple act of having to wake up every morning and get up and go to school instills a work ethic that they will not get anywhere else. School is work to them. They see it as school. It's work. Them knowing they have to be someplace at a certain time, to get up and get ready by that certain time, to get on that bus and go, is a small thing that when that stops, it starts this trigger effect that, well, maybe I don't need to get up and go. It's really not that important. So, I thank you for your time.
Appreciate your comments. Okay, so we're going to move to item number 8, which is a discussion and update on and approval or of the mask mandate and quarantine procedures for employees of Johnson County Board of Education. We had approved in the last meeting mask requirement and asked that we continue to review this at monthly board meetings. This requirement applies to all employees at all facilities when social distancing is not possible. So, Mr. Payne, you have a presentation, I believe?
Well, I think Dr. Simcock's going to start with.
All right.
That is our chart.
I think yours is first.
Yeah. What this is, if you'll look at this green line, that is the active cases in our schools. The black line is how many staff would be quarantined without the masks. So when this red line starts is where our actual quarantine numbers are with the mask. Does that make sense?
For the staff?
For the staff only. So if you look around September 7th or 8th, let's see, when was our board meeting on when did we start the mask? The
10th.
Was it?
The 10th.
When?
The 10th.
The 10th? Okay. You see something went crazy there with COVID in the county. And I don't know what happened, but you can see this black, if you look at the black and red lines, that's where our quarantine numbers are and where they would be if we didn't have masks. The green line, you can see the active cases on a trend downward. Now on the next slide, this is the county's average new case count. Now each day, this is an average of the past 7 days. And the reason they do that is because there's nobody reported on Saturday or Sunday, and then you see these high peaks on Monday. So we just take a week average. So you can see the numbers are declining down. And the state, across the state's doing the same thing. Mm-hmm. And it all happened about the time of our meeting. So, and if you want to see the raw data, I'll tell you why they had to average it. You know, it looks like the red line or orange line, that's the raw data. So you can see those high peaks are on Mondays. Kind of looks like a politician's brainwaves. You know, they're not thinking at all, then something happens, and then, but anyway. But that's why we do an average of the past 7 days, so you get a true number. And you see that trend is going downward. And the county is sort of matching the state. Okay? Any questions on any of those? I think the main one is that first slide. It shows us, and that would be, I think today we had 10 staff that was at work because of the mask that would be quarantined if we didn't. And this is, and it was going down anyway, but for some reason the last 2 days something's happened. I don't know what it was. You had some stuff to add, Ms. Simcock?
I just did a chart just showing overall what it looks like daily, and Rob has that. Just to show our trends as far as with our, not only our staff, but with our students. And, you know, if you follow the dashboard every day, it's just sort of a reflection of the dashboard. So just that first one, Rob. And the top line, which I know it's very hard to see, but with mine, you're looking at data with students and staff. You can see the very top line, the gray line, is our quarantined students. And we do have a lot of students that are quarantined. And I will be honest with you, that does bother me, because kids do need to be in school. So I understand where you're coming from as a parent. I do. But you can see, and it's like Mr. Payne said, we started out really high, and it sort of has declined over the past few weeks. The sort of red line, that is our active students. We do have more positive students having COVID than employees, and that is a switch from last year. Last year, we sort of saw the opposite. We do have more kids this year that is testing positive for COVID.
And another thing I will add, and it's to what I think it's Mr. Griever spoke of, you look at the active cases, the mask didn't change anything. It was on a downward trend, and that event did not affect active cases at all. All it affected was what our guidelines say we have to send people home. And that's the only benefit that I see of the masks right now.
And the bottom few lines that are sort of clustered together, that is our new daily cases with employees, new daily cases with students, and our quarantine employees. If it was on a bigger scale, which is hard to do because where the quarantine numbers are so high, but you did see that in Mr. Payne's chart. When we did implement the masks for our employees, it did drop as far as the number having to go home. Like I stated last time, that will be what shuts schools down because we don't have coverage to fill those staff that had to be quarantined or were positive. So just wanted to share that information and share the data. If you follow the dashboard daily, you do see it, but I'm a visual person, so when you see it on a chart, it is sort of eye-opening.
Wendy, I think one of the big issues here, and one of the issues for our mask mandate was because of quarantine, that we're asked to quarantine by the health department. Can you explain that just a little bit?
Well, they give us an algorithm to follow. I mean, if we want to follow the Tennessee Department of Health guidelines, then that's what we go by. Last year, it didn't matter if you wore a mask. Everybody had to wear a mask, and you had to go home regardless. So the difference this year is that, if both people wear masks, you don't have to quarantine. Which, if all of I don't want our kids to have to go back to work, I'm not saying that, but literally we would probably have like 10 or 15 people on our dashboard if we weren't having to quarantine kids. I've questioned the health department a couple of times of, why we have that 8-day, well, it's 10 days. And technically, they're supposed to be wearing their mask when they come back for the 14 days. But we test them out, we do that, and the reason the health department said that they do that once they've been exposed is because you can harbor the virus and not become symptomatic till up to the 14th day. So if we're not monitoring that, we're going to be in we've had this month, the month of September, we had several kids that tested positive on day 8. Because that's the day we test them out. And whether they're symptomatic or not symptomatic or have symptoms, they've tested positive. And we're just trying to follow what they say. They know a lot more about it than I do. But I've been watching it. We ended up having 52 positive cases the month of September. That's a combination of staff and students.
What if a teacher's or a staff member's been vaccinated versus wearing a mask? Is there any difference when it comes to quarantine data?
You mean like if they're vaccinated, they have to quarantine?
Yeah, like let's say they're exposed, they're wearing a mask, they don't have to quarantine. But what if they're vaccinated and they're not wearing a mask?
They still don't have to quarantine. So that might be an option this time, is to, if you want, not have the vaccinated employees not wear a mask, because they're not going to have to be quarantined anyway, unless they become symptomatic, which we have had a couple. But the problem is a lot of our unvaccinated staff were becoming positive, and because we weren't wearing a mask, it affected all of them. And then some of our vaccinated people become positive because of that too, because they didn't have any protection. But
now here's the way I understand it. and tell me if I'm wrong, but, so, if you've been exposed and you're vaccinated, or you're wearing a mask, either one, you don't have to quarantine. Now, also, the vaccine, the way I understand it, does not prevent you from getting the virus. It only reduces symptoms. Is that right?
Right, you have a less likely chance of getting the virus, but if you do, it lessens the
But
symptoms.
to clarify, you're only talking about staff. We're not talking about students when you're making that statement, correct?
Yes, yes. Well, not worldwide. I mean, if you're vaccinated, it's not going to keep you from getting the virus. It's just going to reduce symptoms. Is that
Well,
what
it's
I'm
gonna be
understanding?
dependent on how long you're around that person too. I mean, if I'm standing beside somebody probably for 5 minutes and I've not got my mask on and I'm vaccinated or not, I may not get it. But if I'm sitting in my car riding to Johnson City with them for an hour, I'm probably
And it
gonna
ain't
get
going to
it.
matter if you've got this on or not, is it?
I don't know.
I'm just
I
asking.
believe in the
I'm not trying to be
mask.
difficult.
I've tested a lot of people. I've had it in my household twice. I've worn my mask the entire time and I've not had it. So, I mean, I think it works, but, you know, I'm a healthcare provider. You know, wear gloves, wear a
I
mask.
have a daughter that was pregnant working in the ER with him, and she wore a mask and she never contracted as far as we know. But some people get it and they're non-symptomatic. She may have had it, we don't even know. I don't know. I don't know who to believe.
Right, and the antibody, you know, statement, you know, that's something that the health department decides. We do not take antibodies as a return to school. That's never been. Even if you've
That
had
gets
the
expensive,
virus,
doesn't
if you've had the virus, you have 90 days. And you may still have the antibodies a year out, but we are not allowed to take that. You have to actually have the test, the antigen test or a PCR test, to get you back into school outside of your 90-day window of having the virus.
So if a student goes home, send them home quarantine, after 3 days, they can go get a PCR test and come back to school.
5.
5
Now,
days.
it used to be 3.
It's 5. It's either on or after day 5 of exposure.
You get a
can the
PCR.
test. But you still can't return till day 8, no matter what.
Now, when did all that change?
At the beginning of this year, like over the summer when they did those guidelines. And they made that just to try to get the kids back a little sooner because it's a test
Actually, they
that
don't,
thing.
I mean, so there's no sense to get the PCR because you're gonna be out 8 days anyway. So I'd say, I kept wondering why parents wasn't taking the kids getting the PCR test because they can come back to school, but if it's outside, they gotta be out 8 days, there's no sense to take them to Johnson City to get a PCR test.
Well, the PCR, according to the health department, it does the DNA, it gets down to the particles where the rapid doesn't, so.
Right, and that'll tell you yes or no immediately.
And like the rapid, like you said, is not always 100%, and that's just like one of those, just like anything, like a strep test or anything. If you get a negative, you're supposed to send it off, you know, for a culture. That's kind of what a PCR is in a way. It's kind of like a culture in a way of a COVID
But
test.
I was all of this year under the assumption if a child went home 3 days, they take a PCR and they come back to school. So that's changed at the beginning of the year. Did it change for us? Did it change for everybody?
It's
never
on,
been 3 days.
it's on the Tennessee Department of Health algorithm. It's always been 5 days. And then if parents don't want their kid tested, you know, to get them back a couple days early, unfortunately, sometimes it falls on a Friday, there really ain't no need to test unless they're symptomatic because day 10, you know, is the following week. If they don't want to test, they have to do the full 10, come back on day 11.
Let's say that person's quarantined. Let's say then they tested positive on day 8. Now, are they gonna have to stay out 10 days after that?
We go back to
No.
symptom onset. So if they had symptoms 3 days prior, we go back to symptom onset. If they were non-symptomatic, we start at that day.
Okay.
So I know it's complicated and it is frustrating, and I don't want these kids to be out either. I mean, I've got another one in quarantine too. But literally, that's not my decision. If we're gonna follow the Tennessee Department of Health guidelines, they're the ones making those rules, and that's what we're trying to follow. And I've had calls this week from other counties, because they hear our numbers are lowest. of anybody around, and they want to know what we're doing. They've literally called me and said, what are you all doing? Because they're not quarantining. And I said, are you all in a mask right now? And she said, yes.
They're not,
Because they're
what do you
on-
mean, what do you mean they're not quarantined?
They're not contact tracing. They're not sending the kids out once they're exposed.
We're the only county in northeast Tennessee, as far as I know, that's doing it.
Johnson City is.
It's Washington
But
County.
they're
Washington County
starting,
just
that's why
They
they're
started,
calling.
okay.
They just-
See,
Okay, I
we've
thought
been
so.
doing it since day one, they're just now starting.
That's why they're calling me, because they want to know what we're doing, because they're going crazy. And we've not had, we've had some ups and downs in quarantining, but we've not had numbers like those other ones have had. I've looked at the health department sends that county to county. We used to have a conference call Wednesdays, but now they just send it by email. And we've always been the lowest, maybe borderline with Unicoi County, because they have low numbers, and maybe Hawkins County, but we've always been the lowest.
Well, I think one of the things that helps that is Johnson County generally has had lower numbers in the county than a lot of those other counties as well. So, and you know, just having the shot, it doesn't stop you, because there's a lot of people who are getting COVID with the vaccination. The vaccination, though, if you look in any of the reports that come out, it was in the high 90s of the people who were in ICUs and on intubated are unvaccinated people. So vaccine doesn't really help. You know, one of the things that we've struggled with for 2 years is masks, no masks, distance, not distance, in school, out of school, virtual school. You know, we've been very diligent in trying to keep our kids in school. And, you know, I talked to a teacher about the effectiveness of having a mask on, you know, when they're teaching. And one of the things is, I would rather have that teacher in school with a mask because of the quarantine rules that we're forced to follow than I would have that teacher out and have a substitute in the school. And that's part of our discussion when we put this mask mandate in effect, is keeping our schools open, because the one thing that would close our schools, and has closed some, is when they get out of staff. And that's what happens to us with flu. I mean, you know, we still got the flu season coming up. So when the flu season comes up and you don't have enough staff to cover, then we have to close. You know, one of the other things that we're faced with is, you know, the governor has said, and I'm getting a little bit off of staff masks, but just to tell you the challenges, the governor says that you can't mandate masks for students. Okay, so we didn't. Now the courts are coming back in a lot of counties and saying, and people are filing suit and saying that we want a mask mandate to protect our child because they have certain problems. And the courts are coming back and making a mandate for those counties. That's not come to us, and it's not come statewide yet, but that's going to be another challenge that we're going to face potentially in the future of that. But I think, you know, one of the things last year, we got into the tussle of we mandated masks, and it was people who didn't want masks versus people who did want masks, and there were a lot of teachers who at the start of the year said, we want you to mandate masks and make sure those masks are in place. So last year it was that we want masks, this year we don't. Are masks effective? I don't know. You know, I'm coughing right now, that's why I got my mask on, because I don't want to spread germs. I've gotten kind of used to the mask. We do know that last year masks, we didn't have flu. Most people didn't have flu. Everywhere they had masks, you didn't see much flu going around. I also, and I agree, I know there's a lot of statistics, and of course if you listen to the experts, you know, the experts disagree on all this, and I've always questioned 6 feet. But I do know that, you know, the masks did help last year as far as a lot of other problems and keeping things down. And I've seen in the environments that I'm in where there are a lot of COVID patients, and it does protect us from potential spray. Yeah, you can get into the microns and, you know, do you have a proper N95 mask on? But most of the time you're not in that kind of contact either. So, you know, I think, in my opinion, and this is just, I'm speaking for myself, the reason that we put this in place was because of the tug of war between, do we quarantine somebody, which we're not in control of quarantine. I mean, the reason I asked you that question is because if we're in control of quarantine, then let's discuss quarantine. Because I think that would be a different discussion that we would have. But we also want to make sure that we have school, that we have teachers teaching and not looking for a lot of substitutes for those kids, because I'd much rather have a teacher teaching, and substitutes do a great job. I'm not criticizing substitutes. But that's our whole purpose in doing this, is to try to keep our schools going and keep teachers from and staff from being out. And, you know, so far we've done a pretty good job of it. I know it doesn't, there's no perfect science. I wish that COVID would go away. But we struggled with this for 2 years now.
Yeah, another thing too,
2.5
I mean,
years.
we can talk masks, but, and there was no flu last year, but there was more variables than masks. We had.
There are.
We had
You're-
kids were hand washing.
You're exactly
started
right.
cleaning more, we had the mask. I mean.
It all goes together,
you
and we're
can't
still doing
change-
that.
You can't change 5 things and say one thing fixed it.
I'm not saying one thing fixed it,
Yeah,
but
I know,
I'm saying
I know,
that
but-
there's a lot of things that went together that we still have in place.
Yeah, yeah, we
Which
did.
leads us back to Jerry's request.
Well, let me make a comment. Mr. Griever mentioned, which you covered a whole lot of things that he said, but the other thing that he said that struck me, that there was money tied to what we do with the masks and the cleaning, but there's not. There's nothing tied to us wearing a mask, any kind of funds from the state or from the federal government. It's only done for safety issues, and there's no monetary, nothing attached to it. I just wanted to correct that, because I caught that when you said that. I just wanted to correct it, and to make sure everybody else heard it too.
Well, one of the other things, and I'll stop. One of the other things is, it's not just death that we worry about. They're finding a lot of long-term health effects from people who have COVID, both in the kids and in the adults. And heart difficulties or cardiac problems are part of that. And again, this is also new. Do we know exactly stuff? No, but we're trying to be careful. So, I mean, all we've done is tried to protect, you know, to the best of our ability, the staff and the students, and to keep people in school, which is why the quarantine is really the problem. So if that quarantine could ever be changed, that would benefit us greatly.
It may be the solution too, to keep it from spreading, so.
Could be. So, I mean,
But
you know,
both.
we're not
Okay.
experts, so we take our directions from the health department. So
Yeah.
I wish it was different. So what is for the first issue, we're on number 8. So the issue is, do we continue the mask mandate for teachers, or do we lift it? And I would need so the item here is approval of the mask mandate, so I would need a motion and a second to bring this to the floor.
Mr. Chairman, I move we disperse with the mask mandate for the staff.
Okay, well, but
That's
the
not
motion here is
If-
approval.
if it's
So
not- if it doesn't
if we
come
if we
forward, then
don't
that's the
have a
case.
motion, then it dies.
Yep.
Motion for approval?
Yeah, this is approval. Right here, approval of mask mandate. So the motion would be the approval of it. So if we don't have a motion, then it dies.
Well, I'll make a motion that we approve the mask mandate.
Okay, so we have a motion from Ms. Reese. Do we have a second? All right, there's not a second, so I guess then this will eliminate your mask mandate for your
But-
staff.
We need to discuss it again next meeting.
Yeah,
So keep it on there to reassess monthly?
Yep.
right. So what we will look at is if this, you know, creates a problem for our staff, then, you know, we may go back to this, and we may go back and forth trying to judge. It's not an easy thing.
Just like
so.
the chart says, if something happened, we don't know if it's a mask or if it was just
That
the
was
population.
before, that was before the mask. There was something crazy
Something,
going on at
yeah.
the time we did that.
So this
So
will,
you but then if you look at the active cases, it's still on a trend. The mask did not affect it at all for our staff.
right.
All right, so we're eliminating the mask mandate. We'll reassess it at the next board meeting, and
Well,
one of the things,
let me say this, if something drastic happens, call a board meeting,
we will.
We can do that.
and we can reassess it prior
Well,
to.
Without
it'll
a
help that next
with-
week's fall break, so that will help.
Yeah,
Without a spike in a day or so, I mean, we
Right.
don't want to do that.
No.
All right, so our next portion is to go back to Mr. Gentry. So, Youth Basketball League. What is the pleasure of the board on this one as far as the potential for spread?
who does the janitors do all the fogging in the gyms? So it's janitor, say like at Laurel, if you would have to be done prior to,
We do not have the staff. We only have one janitor there who is there from 7 a.m. to 3 p.m.
till 3, that was my question when he left.
I feel that it might be a good idea if they're gonna use their gyms to maybe have a day set aside to train the coaches and have the equipment there and let them do the fogging and the cleaning.
If that's possible, if you can do that and everything be good and the coaches, I don't have a problem.
I think that would be our best option.
Jared, what are you gonna do at your games? Because you're in close confines in the gym.
Turn that
That
fog on
will
all
be-
the time. Just turn that fog on idle and just let it idle through the game.
That's a decision that would be made by the board, and with talking with the school system as far as, number of people and so far, and how we could enforce that. But that would be a board decision that we haven't had a meeting, and to be honest with you, I'm retiring. I'm just helping them get started this year. So that would be a future board decision that hasn't been made yet.
The other question I had, which school? I know you use Laurel and you use Doe and Rome Creek
And Mountain City.
Mount City.
and Mount City? Do
For
you-
practice.
For practice.
For practice,
They
okay,
only play at Doe and Rum Creek.
okay.
And the Mountain City may be hindered depending on when Esther is approved and we can start
Right.
over there.
Well, I can tell you one thing, I believe your quarantines are gonna go up with all this. So, when we approve this, and, I know there are people for and people against. Everything we do, I don't care one way we go, the other way we go, we get criticized from the other side. But I believe we're gonna see this get a lot worse, and when we do, I think it's gonna be back to the board, and we're just gonna have to make another difficult decision.
Hey, let's keep that chart
Let's hope
going and
not.
we'll see.
Let's hope
And then
not.
let's bring that chart back next meeting.
I'll keep sending you the.
When are you planning on starting to play?
Normally, we will start in November after football season with the practices. Maybe the first game would be right before Thanksgiving or right after Thanksgiving. That's normally has been the schedule in the past, but
That gives us time
Could
to
could
see.
they give
There are a
us
whole lot of
wait till the
changes
next meeting then to
that
make a
potential.
decision, see what happens?
Well, they gotta practice.
yeah, see, that's what I said was the first step, is coming here before we even proceed.
Well, there's, on that board, as long as I've been around, there's always good people on those boards. That's baseball, football, basketball. They've always been good, level-headed people on there. You have an exception every now and then, but normally I think we can, from what I've seen so far, do you trust the people on your board now? Jerry, you got a good bunch, don't you?
We do, we're gonna have to we've had 2 resign already, but, with Ms. Simcock's on the board, we've been able to get through any problems that has arose with the school system. And, it's gonna be difficult. I mean, there's no doubt, no way, whichever way we go, you've got a lot of potential. And if you get a team quarantine, well, that team ain't gonna get as many games as another one, so there's just so many loose ends that we can't.
I'm not as worried
tie up right
about the
now.
basketball game as I am that team getting quarantined and then, that coming down to the
That's
school.
affect 2 teams.
Well, you know, the schools.
Yeah.
Yeah.
I'm interested in
So
kids staying in school.
When did you say you're gonna start practicing?
Normally the first part of November,
First part
right
of
after
November.
football.
Right, football. We could give you the approval contingent on what your board said. We give you approval on our end, that would give you the opportunity to say, we've got the approval. See what they say.
See what they think.
And then
is-
in November, we can,
Because it's gonna be very difficult either way.
Yeah.
There's no ands, if, or buts. It's gonna be real challenging.
All right.
is that what? Do we
I'll
need to do
second
that?
what he said.
Do we need a motion? You want a motion?
No, we just need to agree, this is
Just an agreement. Don't need a motion. If y'all give them the
Oh,
opportunity
that's right.
to
It's not an
start.
agenda
anyway.
item. Okay, never mind.
All right.
Going back to item A, and we were talking about not wearing a mask. If the teacher still want to wear a mask, it's totally up to them. You're free to either wear them or not wear them. But if you want to wear them, wear them. That's no big deal to us. But if you feel like you need to wear them, wear them.
All right. Next item is our consent agenda.
Oh, no.
What? Oh, Board of Distinction. Yeah. We forgot about that. So we'll give you a few minutes. If y'all want to stay for the meeting, we'd love for you to stay. If you want to, since you know we've covered your agenda item.
If you wanna hang around, that's good too.
Next item is Mr. Long, who is the District Director for Upper East Tennessee for the Tennessee School Board Association. I'll turn this over to you, Kevin.
Thank you, Chairman. I'm going to give you the same spiel. I've done this is the fourth time across Northeast Tennessee, and I'm tickled to death to do it every time I do it, but I'm going to give us the same thing I give the rest of them, so it'll be official. Thank you, Chairman Carl, Dr. Simcock, members of the board. It's my privilege to be here tonight to present to you the TSBA Board of Distinction Award. This award is one of TSBA's most prestigious awards. I commend your board for meeting the requirements in 4 key areas: planning, policy, promotion, and board development. As you know, the requirements are extensive and not every board qualifies as a board of distinction. On that, we have 141 members of the TSBA, 141 school boards across the state of Tennessee, and there's only 23 boards of distinction, which we are one of. And there's only 4 in Northeast Tennessee. So that's pretty good rating, I think. On behalf of the Tennessee School Board Association, I'm proud to present the Board of Distinction Award to the Johnson County Board of Education.
I think let's get our whole board.
The whole board come down, don't you?
Serena, you done that?
Oh, I ain't wondering.
Great.
You
And we can't
go
leave
without Serena.
her. We can't leave her board secretary out. She does all the work.
Come on, get out. Sit around here. Yeah.
Come around the front.
Can we get in?
We need to be 6 feet apart. We're ready. Here, wait a minute.
Take your mask off.
Wait a minute. Yeah. I wear these so often, I don't even remember when I got them on, when I got them on. I'm eating and I got my mask on. We appreciate that, and that, the way that these come about, there are a lot of qualifications and a lot of things that our board has to do over the what is it, 2-3 years in between to get one of these awards, and a lot of it's training and attending the meetings that they have and showing different things and being evaluated by another board. So we've all done that. And as you can see, our board's been a board of distinction for quite a few years, which we're very proud of. All right, next item is consent agenda. If you would, let's look through the consent agenda, and if there's anything you want to pull off, and if not, if we have a motion.
Just to clarify, the third item down is just a wording change.
Yes, just the wording change that the
Wording
auditor requested.
I move we approve the consent agenda.
All right.
Now, second.
Have a motion, we have a second. Any discussion? All right, call the roll, please.
Mr. Long?
Yes.
Mr. Payne?
Yes.
Ms. Reese?
Yes.
Mr. Carlton?
Yes. Next item, Braden Gentry.
Good evening, parents, students, and staff. Homecoming week was a great success and a great opportunity to show Longhorn spirit. The drama department is very excited to announce they will be returning to Heritage Hall with their first in-person play this year. The performance Snow Angel will be on October 22nd, 23rd, and the 24th. Senior ACT Day was this week and very successful. We are very confident that our seniors improved their scores. The JCHS FFA is also currently doing their annual citrus fruit sales. See an FFA member for information. Join the Longhorn football team tomorrow at Happy Valley and again at home on October 26th against Cloudland. Our last home football game will be October 29th.
All right, thank you, Braden. All right, next item is to approve the CTE Spark 3.0 grant, and that stands for Supporting Post-Secondary Access in Rural Communities in the amount of $124,703.
And I'm going to turn that over to Mr. Adams. This is a grant he's wrote for CTE that he writes every year, so we're very proud that we got this again.
These are funds set aside by the Tennessee Higher Education Commission for at-risk and distressed counties, and we fall in the at-risk category when it comes to workforce and labor. So we use $124,000 toward industry credentials, supplies, anything like that. This is a 25-month grant, so we'll take care of those needs for the next 2 years.
Okay, good deal. Do we have a motion?
Yeah, I'll make a motion to approve it.
Do we have a second?
I'll second.
All right, call the roll, please.
Mr. Long?
Yes.
Mr. Payne?
Yes.
Ms. Reese?
Yes.
Mr. Carlton?
Yes. All right, keep standing, Irby.
Yeah.
Approve the quote from Realtek to purchase items using the Spark 3.0 grant in the amount of $70,534.
Relatech is a distributor for Festo equipment. I think Mr. Payne's probably familiar with Festo equipment. And it's all stuff for a STEM lab that we're working on. We have a mechatronics, the portion of it now that Ms. Dishman works with. TCAT has pledged to buy us $80,000 worth of labs, and this 70 will be enough to finish the complete lab. Elizabeth and Unicor are the only two counties, or only two school systems in First District that has those. That'll complete our lab. So we'll have a complete Festo STEM lab.
So tell us a little bit more about that lab. What is it?
Well, I'll tell you the portions that we were purchased with our funding. The automation and robotics, there's a CAD program, CNC lathe, CNC mill, engineering and stress analysis, Bionics kit, Bionics flour, which I have no idea what that is. All of this came from TCAT. And what we would do, there's certifications that goes along with these, and there's also dual enrollment opportunities at the TCAT that goes along with these.
Well, that's what I was gonna ask, if that was gonna give us an opportunity to have another class, TK class up here.
It would be credits that they would take with them directly from Ms. Dishman's class to theirs,
Okay.
instead of having us in the class.
That's great.
Okay.
All right, do we have a motion?
Move we approve?
Have a motion, do we have a second?
Yeah, I'll second.
All right, call the roll, please.
Mr. Long?
Yes.
Mr. Payne?
Yes.
Ms. Reese?
Yes.
Mr. Carlton?
Yes. All right, presentation of the report card, Dr. Long and Angie Wills.
Yeah, so before they start, the report card was released last week. And, even though we did deal with COVID last year and we did see, some drops compared to our 18-19 data, which you'll see, we did outscore the state in a lot of areas. And I'm very proud of the hard work that our students and our teachers did. And you'll see that in the report card. So don't be taken back when you see 30% on track or mastered. when you compare it to the state and other systems that were maybe 23%, we did see a lot of growth in a lot of areas, and we did see some performance and some learning going on despite what we went through last year. So we are very pleased with the results, considering it was a very hard year.
All right, so we'll begin. The first slide just shows the overall success rate. That means on track and mastered. Again, the 4 categories are below, approaching, on track and mastered. On track and mastered are considered passing, if you will. So the top line, you can see the state. We usually put 3 years. Obviously, there's no data for 2020, unfortunately. But you can see that the state fell by almost 9%. In the district, we fell by about 7. We trailed them by 0.9 of a point. You can see in the elementaries there, Ms. Wills, if you want to add anything.
No, we did drop a little bit in each of our elementary schools. The smallest drop was Rome Creek. They went from 30.7 to 30.1, so, really happy that they didn't drop, they didn't have a drastic drop, so that was definitely a good thing. But it could have been much worse. Our drops were smaller than those in the districts around us in the state.
Yeah, I'm really pleased with the middle school there with the 0.2 of a point drop. That's very small. The 2 bottom schools are the Connections Academies. Those are our statewide virtual schools. They're not brick and mortar schools here. They did not exist prior to last year, so that's why you only see 1 year of data there. And we are working very closely with them on their improvement plans and their policies and procedures. We will continue to break the data apart, but just know moving forward when it comes to grad rate, all of those things, their data will be lumped in with ours. So we'll be sure and give you Johnson County High School's grad rate, for instance, and not just the district-wide.
And our district, this data would have been higher on that district score at 26.1 if we had taken, or 26.9 if we had taken them out.
So because there are people watching online, explain this just a little bit more, what this means. Your overall success rate, mastered, on track.
That's the percentage of students that passed the math and ELA tests and science.
It's like the old proficient and advanced.
It is.
Yeah. So
But it's all subjects lumped together.
Yeah, you've got below, approaching, on track, mastered. So it's the top. If you consider that levels 1, 2, 3, and 4, it's levels 3 and 4. That's considered passing.
Who creates these tests? Is that the
Pearson.
Based on Tennessee standards.
Okay.
So the next 2 slides, you've got the exact same thing, but just broken apart for just math, and then the following will be ELA.
Our math did drop more than our ELA, and so you can see that it did drop at Doe. At Laurel, there was quite a drastic jump, or drastic drop. Mountain City and Rome Creek also dropped. So one thing that we're doing at the elementary level is we've really got to get focused back on our math. And so one of the things that we had been really focused on in prior years was, and it was a requirement by the state that we had to do a CRA assessment, and that's not a requirement now, but when we had really focused on that, we were seeing, quite a few increases and jumps in a positive direction. So we have teacher academies. I'm sure you see that in the Friday updates. But one of the things that we're covering in our teacher academy, with every grade level, we've kind of restructured those. And so we're doing some professional development on that. And then we are choosing on our own, we're going to have our own CRA assessment to just really assess within our district. I mean, it's no real accountability, but it will be some good data for us to look at, to see, are we really honing in on the right things with math, really looking at the math practice standards and trying to really have a specific focus to increase our math and get that back up where it needs to be.
So, if you look at that, it's really to be, something to be proud of. Look at our elementary schools. And if I'm right, doesn't Laurel have a whole lot of special education students?
Yes, they do.
So, if you look at those numbers, I think it's something to be proud of. Even though it looks like we dropped, but my goodness, look at COVID and what we've had to go through.
Yeah. One thing I'd like to point out to you again, and if they're watching, I don't mean to disparage them specifically, but again, these two bottom numbers, the Connections Academy numbers. If you look at our district rate of 23.9, and then you look at the majority of our other schools, that doesn't add up. Why is the district rate only 23.9 when Mountain City's at 41.2 and Rome Creek's at 32.6? That's the majority of your kids right there.
And that was 37.1.
Yeah.
Yes, so there are hundreds of students in these schools, so these numbers drug this number down substantially. Also, wouldn't be doing my job if I didn't say shout out to the middle school on that number. They actually went up by 5%, which is quite an accomplishment in that span of time. Really proud of them. High school's got some, Mr. Henley said the same thing. We've got some work to do in that department. We've restructured that department. Namely, we've made Algebra 2 a year-long course, which was a long-standing need. So we're working on that.
So are you able to pull, like when you present this to us the next time, can you pull those two out on a slide so that we see what our actual district scores? I mean, we can look at the individual school scores and see.
Can't do that.
I think if you take the data file and extract it.
Extract it, we can.
I'm not sure.
Well, just something to think about.
I mean, it's extracted
But I
here,
mean,
school by
rather
school,
than-
but the thing is, it's not a straight average. So, you've got 70 kids here and 500 kids here.
But
It's a weighted average.
essentially what you're telling us, though, we can just look at the schools and not look at the totals.
What we have control of instead, because we really have no control over those schools.
No.
Really, as far as the instruction side, right, or any.
Yeah, right.
We can try to encourage, like, we do have to approve their school improvement plans and things like that, and we did spend a lot of time really looking at that plan and, sending it back for revisions and pointing some things out that our schools do, and encouraging them to incorporate some of that, but that's honestly not all we can do.
Yeah. Next slide, exact same data about ELA. ELA was much more encouraging. The drops were much less pronounced, and in several instances, you had a very small drop at Doe. You had a gain at Laurel, a gain at Mountain City, a gain at Rome Creek, small drop at the middle, a small drop at the high school. So, but much less pronounced, even positive changes there, which is a reflection of our district-wide focus on literacy, which
So when you
I know
focus
Ms.
on-
Wills could literally talk to you about.
So when you focus on math, we ought to see these same kind of scores?
Well, we are hoping. We're focused on everything. I mean, we're not giving any up on ELA either.
The literacy focus is a statewide initiative. I mean, you'll see a lot about early literacy and so forth.
Yeah.
So, I know you all always like to see this. I did include one non-county district on there just for comparison. It is one of our close neighbors, Elizabethton. But if you look, all the rest of them are county districts. And so our overall, this is just taken straight from the 3 previous slides, our overall proficiency rate was success rate, the state calls it 26.9, 23.9 in math, 29.1 in ELA. That is higher than every county system around, with the exception of Washington and Greene County's math. Again,
Elizabeth.
we're not hanging our hat, well, I
Elizabeth
said,
and City, yeah.
well, it's higher than every county system around, yeah. So, again, we don't hang our hat on that. We've got so much opportunity for improvement, but.
We do have a lot of
We're not
positive.
alone, we're not alone in the struggle.
We don't,
Exactly.
we're not alone in the struggle, and we don't want to miss an opportunity to point out how exceptionally hard our teachers worked last year to get these numbers.
And it shows.
I mean, they showed up and showed out every day, and it was not easy. A lot of, with the kids coming in and out of quarantine and so forth, to have made gains in ELA at all over 2019 was quite an accomplishment.
Weren't some of those schools out on virtual more?
Yes.
Mhm.
Yes, sir. Yes, sir. Overall student academic growth, this is what you hear called TVOS or TVAS, depending on I say both, depending on what day it is. The district did go from a 4 to a 1. Now this is, we've talked a lot in the past, so we won't, unless you have questions, we won't talk a whole lot about here. TVOS is a little bit more mysterious than just pass rate numbers. We sometimes can explain to you, with Doe being 3 and Laurel 2, Mountain City 3, Rome Creek 5, middle school 4, high school 1, why the district's just a 1, although I will say that the Connections Academy would have also played a big role in that too. The district was a 4 the last time we got data. So that is more a very low-level explanation of TVOS. They look at students, they compare them to other students across the state with similar academic histories. They use some big formula to make a projection of where they think that student's going to land after a year of learning, and then they give you a scale of 1 to 5 based on where that student actually lands. And it's
a mysterious formula.
It certainly is. Questions on that? That's all I'll say about it. Ms. Wills, do you have anything to add? And so I won't give a lot of commentary on these. The next 2 slides are identical, just math and ELA pulled out.
We were very happy with Earl Creek that they had maintained a 5, both years, so from 2019 to 21.
Absolutely. They did an outstanding job, and again, proud of the progress the middle school's made.
Yes.
And there's your ELA growth. The next slide is chronic absenteeism. Pat on the back to Ms. Miller here. She works very hard along with our school level folks who work very hard on this. You see that our district, this is like golf, the lower the better, right? So in district 2019, 7.9, spiked to 10.3 in 2020, and then spiked again to 10.7. I can tell you here without question, that comes from right here. And we're working with them very seriously on this.
Is this the Pearson group that we support?
Yes.
Mm-hmm.
This is the statewide
Yeah.
one.
And this hasn't hurt us this year, and so we've questioned them very intently on how this could have happened, and we've gotten some logical
How many
answers.
students do they have enrolled? Do we know?
I do. This is currently in the statewide one, 9 through 12, they have 1,115. In K-8, they have 1,460. In our county one, which is included in our district numbers, they're not broken out separately, we now have 60 in our county.
Pearson is based on the number of students, they base a monetary gain to the district, right?
Correct.
Yeah. Just real quickly here, look at the improvement from 2019. Now, throw out 2020, but look at the improvement from 2019 to 2021 on our schools. The high school had a small spike, but they did drop from 2020 to 2021. So really great job trying to keep our kids in school and track them and keep up with them and go get them in some cases, knock on the door if we have to. Ready Grad and grad rate. 2019 was a banner year with Ready Grad. Ready Grad is students that scored a 21 or above on the ACT, or they had 3 early post-secondary opportunity classes. That's an AP or a dual enrollment class, or they had 1 and with 2 industry certifications. And so 2019 was just an unusually high cohort for us of students scoring over 21. So in 2020, it dropped to 26.1, which was a huge drop, but not completely out of line with 2018. And then this year, it rebounded back up 0.8 of a point, so we were pleased with that. One thing that I'm extremely proud of with the high school, though, is our grad rate. Our grad rate, if it drops below 96% for us, we haven't had a really good year. A lot of districts across the state would love to have a 95% grad rate one year. But for us, 95 is sort of an off year. With everything that went on last year with students being able to opt virtual, and sometimes that made them very hard to keep up with, I will lie to you, we still managed to maintain a 96.2% graduation rate. So hats off to the high school and all the hard work they did up there. This is a huge focus for us. It's an issue. It's another item on your agenda, so I'll probably reserve most of my comments for then if you're okay with that. There's a lot of things that we're doing to try to address this.
Why don't you just go ahead, this item number 10.
It's just an update on the 5-year plan, which follows along what we're doing with ACT. So I'd ask Dr. Long and Mr. Henley to show y'all just some of the highlights really briefly of things we're doing to focus, because this
Can I
is our
circle right
focus.
back to it when I get to the last,
Yeah.
slide? I think there's only one more slide. Well, there's one more after this. This is the percentage of students scoring 21 or above. We've had that on the report card in the past. You can see that there are some practices we need to improve on around the ACT, and we're working hard on that, but now the pandemic did take a toll. When students didn't go to school from March 16th on of that one year, and then last year being as muddled as it was at times, it definitely had a negative impact on our ACT performance. Really proud of this. The state tracks this college going rate, CGR. To be clear, they like that word college. That's anything post-secondary, okay? So that's technical schools, technical school, trade school, community college, military. So, and of course, four-year college and university. During the pandemic, the state college growing rate decreased by 4.9%. If you look at us in 2019, we were about 12.8, I'm not as good at that anymore. We were about 13% behind the state in 2019, but in 2020, in the midst of the pandemic, we went up by 9%, while they went down by 4.9%, and so as of last year, we're back ahead of them with our college going rate. The one thing we've got to work on there for all of you, Herbie's talking about STEM labs and things like that, and that's awesome. That is absolutely what we've got to be focusing on. We have an amazing CTE program. It's the envy of a lot of other places in the state, and that's not a lie. We hear that from everybody that comes up here. We've got to continue to translate that into those students leaving those programs and going to the TCAT and getting a certificate so that they can get the skilled labor wage that they deserve. Most of it's a geographic barrier. Still trying to get around the lake and back up Stony Creek a little ways to the TCAT, and that's why we're proud to get this up here. We're pushing and pushing and pushing, and Herbie can talk about this for a long time, to get more programs added up here, and it's a work in progress. Any questions about that before I backtrack to ACT?
Very good.
There's one question and I've never seen this statistic, but is there anyone that tracks the number of students that go into college that complete?
That's study, yeah, I was curious about
TA,
that.
yeah.
Is there any
College completion rate.
Yeah.
Yeah, that's something that, I don't have that data. I'll hunt for it. They don't send it to us. Gear Up sends us this. I get this because of our affiliation with Gear Up. But that is, the first thing's to get them there, the CGR. But then the completion rate, as you might guess, isn't nearly as good as the going rate. And that's where they like to talk about, use terms like grit and match and fit. So we've got to continue to improve in that, but I will look for that data for you. I do not have it, so I wouldn't hazard a guess.
I didn't even know if anybody kept up with that or not.
Well, I just want to thank our teachers and principals and, our support staff who keep everything going, because there was a lot of opportunity for a lot more loss, and there was a lot of loss. And, the work that you all are doing, is good, and this kind of compares. And the reason we compare ourselves with other folks is, to make sure that, we're on track. And so keep up the good work. I think it says a lot about what you've done during everything else that we've been through.
And we're in the middle of the benchmark window, that ends Friday, and so, we'll get data back within a couple of weeks, and we're all very anxious. We'll know how are we currently comparing to other districts, even looking at our benchmarks.
Yeah. All right, Dr. Long?
Mr. Henley?
One of your 5-year plan updates is to strive to increase our average ACT composite score to a 21. An additional ACT support will be provided for students. We are definitely having a focus of ACT K-12. We'll say that this is an initiative we are doing K-12, pre-K-12, because it actually starts in pre-K, just with those conversations about college and career readiness and ACT. But we're doing some great things at the high school right now with our focus, so I just wanted to share a few things of what. And the seniors just did the retake on Tuesday. I think you had 85.
Yeah, around 85.
Retake it. So.
Yeah. Around ACT, you know, I really believe to increase your ACT score, we have to increase Tier 1 instruction, which is basically the instruction that all our kids are getting. And to do that, we're going about that a couple ways. Like with our math department, we were able to hire an additional math teacher. We got our Algebra 2 moved from a semester course, so like half the kids were taking it one semester, the other kids were taking it in the spring semester. They would take the ACT in the spring. Some of them hadn't had any math, so we've increased that to a year-long class. So those Algebra 2 teachers, and that's our juniors, by the way, that are taking the ACT, and that's their Algebra 2, so that they can slow down and actually cover the standards, plus get a little time more in for review and preparation. Last year we only had, and one plus, like for our value added, it didn't show there. Like traditionally, our Algebra 2 had been like a level 1. It went up to a level 3 last year. Our geometry had been a level 1 for a long time. It had gone up to a level 2. So we did have some growth in some areas, but there were a couple that were lower that brought down the overall. So I do want to point that out. Also with our ELA, we moved some personnel around to give a boost to some of the areas that we thought they needed a boost there. And that's our instructional changes as far as personnel goes. We also added, for our seniors this year, we had a program called Jump Start that they had kind of got pushed through as juniors towards the end of last year. We took our volunteer seniors that would agree to go through that leading up to this past retake day. And in order to do that, we provided some incentives and stuff to get those seniors to, because they only have to take it one time. And if you do any research on ACT, the more you take it, typically your scores will increase. You know, you get familiar with the formats, you know what your weaknesses are, you can work on those weaknesses. So we gave our seniors a pre-test back early on, and then based on how they scored on their pre-test is how we remediated them in their preparation for their retake this past week. So we had about half of our seniors that took advantage of that, about half of them didn't, and we feel confident that the ones who did, the vast majority of those did want to see their scores improve. Another barrier sometimes that you have to overcome that I've learned at the high school is, you know, we send a lot of kids to college, you know, with the college going rate. We also send a lot of kids to these technical schools and TCAT. Well, a lot of those students don't see that the ACT is very important, that they can just go, so they'll just blow it off, you know. They may be a great welder, they may be going for electrician or whatever, but they don't put a lot of importance on that. So we have to, you know, try to make them understand that that's important as well. And the military, we've talked to some of those folks, and they gave us some, you know, some barriers to overcome to the kids that want to go in the military, that the ACT scores also helps with the way that they can place them in certain programs as well. So, I mean, we could talk a long time. I know it's been a long night already for some of you. If any of you want any additional information or of what we're trying to do or what we've got in place, I'll be glad to, you know, talk with you over it.
Yeah. I can talk about ACT all night. Nobody wants to hear that. Are there any questions?
Well, we're glad to hear what you're doing for improving all these.
One other thing we are doing is now that the seniors took the ACT, we had a group of 5 teachers that were putting them through that program he alluded to. Now they're going to pivot during that 45-minute block of time, that from 1 to 1:45 every day, and they are going to look at juniors, their previous test data. They took a pre-ACT last year, which is from ACT, and they're going to pull them 1, 2, 5 at a time and work on exactly what they need before they take the test in March. So I'm really excited about that. It's a very specific intervention.
And we were able to free up 5 of our teachers that we felt were, you know, could benefit those students the most in those areas too.
Thank you all.
All right. Next item, elect a new Tennessee legislative representative. This is a board member who helps track legislative updates and reports it to the board.
It is that time of year, and I think currently it is Joanne.
I think she's done a good job.
She has done a great job.
I would agree with that.
So, do you need a motion on that?
Do we take a motion on
I
that?
guess everybody who's for Ms. Reese to continue, raise your hand.
Yeah.
Okay, you've been elected again, Joanne.
Thank you.
Congratulations. All right. Do you have a budget update?
I
Ms.
do.
Whitford's not with us
Yes,
tonight.
she's gone to a training. She has your packet and your information. She did want me to make you aware that revenue for the month of September has not yet been posted since we're a week early due to fall break. The school department as of October 6th was 8.8% revenue received and 20.12% of appropriations have been expended in the general school purpose fund.
And that's normal for the start of the year.
That is normal for the start of the year, and your packet's there, and if you have any questions, I'll be happy to answer them, or Tina will be back in the office tomorrow.
All right. And then we have, you gonna talk about this?
Yes, and you do have in front of you the budget of the Johnson County. That includes all county budgets plus the school system. That's something they give you all yearly, and I think we got that last week, so she just wanted me to give you each one of those books.
All right, we've got the director's report.
You had your Head Start pre-K information. Lori, do you have anything you want to share? Okay. Fall break is next week, so schools will be closed from Monday through Friday. Central office will be closed, but it will be open Friday because it's payday for support staff.
How many kids will come off quarantine during this next week?
According to the dashboard today, all of them.
So we'll come back.
Yes,
Clean
unless
slate.
something happens during fall break.
And during the fall break, we going into the schools
We
and
are-
doing a deep clean?
They are
Extra
doing
clean.
deep cleaning at every single school.
Did we, this isn't the time for questions, but I'm gonna ask it anyway. Did we get the units installed in the air ducts?
Is TVA coming to do the walkthrough?
The TVA is supposed to come back, I think, next Thursday and do the final walkthrough.
Okay.
Got from Safe Air.
All right.
And we are in the process of, with ESSER 2, we did purchase the water fountains for the reusable bottles, and we're still in the process of getting those into the schools. This takes a long time. So we're still working on that.
All right.
Trust Appreciation Day for custodians is next Thursday. We definitely appreciate all our custodians do every year, but the past 2 years, they have worked extremely hard.
I seen the bus, who made the video of the bus and put it on YouTube, at the middle school. I like that.
And they actually won $100 from U-Trust.
Good.
She received word yesterday to go back into their U-Trust account. So, yeah, they were awarded for that yesterday. Just a few little items that's not on there. ESSER 3 update, we are still awaiting for final approval, but it has went through all the chains except the last one. Angie actually reached out today, so we're still just waiting on that final approval, and when they do, then I know Miss Triplett is ready for us to start on her school. So once that gets approved, there's a lot of those things we can get into place.
I don't remember on that, how we're gonna do the parking? Is there gonna be some additional parking somewhere? Because they're taking that lot up, ain't they?
I'm thinking
It's
there was
taking
some
part
on the
of that lot.
side, wasn't there,
Part of
Herbie?
it, but I think
Down there in that empty field.
Yeah, it's in that empty
The
field.
driveway will have to come around a different direction.
Yeah, it'll have to come all the way around and come out sort of there in front of, between the Christian church, that road.
So again, because you're online, can you explain what you're talking to?
Yes, ESSER
Talk about-
3.0, one of the main thing that ESSER 3.0 is going to be is to add a gym to Mountain City that will look just like the one at Doe. And the existing gym will turn into 4 classrooms because Mountain City is very overcrowded. So they definitely need additional space. So that's what the majority of the ESSER 3 funds are going to. But we can't start anything until we have approval.
And the ESSER 3 funds are grant money?
Yes, federal funds. I do want to let y'all know, we received word yesterday, myself, Ms. Wills, Dr. Long, and Mr. Adams, along with Kevin, will be presenting at the TSBA in November on innovations in our CTE program. So we're going to be working on a video. Chase is going to actually do a video for us, so ours will definitely be the best breakout session down there. It'll be Saturday morning. I think it was 8:45 to 9:45, so I hope y'all will join us
If
on
we
that.
still get to have the convention?
We will have it. We're presenting.
It's rolling. Other than the mayor and Asheville stopping, it ain't gonna stop.
And then just my last thing, I do want to congratulate Kevin again for receiving his 3-year award for, or election for the TSBA Board of Directors. It's definitely an honor to have someone from Johnson County on that board, so very, very proud of you. And also proud of Joanne. She received her level 3 status when we had our little TSBA thing last week, so congratulations to you.
And with this presentation, that should enable you to get your master board member?
Yes.
Good deal.
He is our moderator, and he's going to introduce us all. He didn't know that, but we've got him in our PowerPoint. So.
All right. So, Mr. Payne?
I don't have anything.
All right, Ms. Reed?
I just want to thank everyone for everything they're doing, and I'm going to have a well-deserved week off next week, and I hope everybody stays well and stays safe.
Mr. Long?
Just a couple things. I went down and had a board of directors meeting, some things that you two guys will be voting on in November. One of them is getting rid of end of course testing. That's leaning toward that. So it really don't count for anything. It puts a strain on the students, it puts a strain on the teachers, and that they are suggesting that go away. Maybe not this year, but eventually. So, and the Cranberry Festival. Anybody that remembers Mr. Buckles and his efforts to get everybody out. Cranberry Festival's Friday and Saturday. Friday night's bean supper and auction. Then Saturday is a parade. We didn't have a parade last year, so we got the parade back, and then the field full of vendors again this year. So everybody come out and support the community and the old school building.
All right. I think I've already said what I needed to say. Is there anything else to add? All right. Do we have a motion?
I make a motion to adjourn.
We're adjourned.